And thank you, everybody. We're going to get started. I think everybody's here, and as parents are joining us, we'll bring them in and just give them the information. So thank you, everybody, once again for joining us today. My name is Berenice Pan. I work with Family and Community Engagement, Chicago Public Schools. And as you guys know, I'm also a mom and an alum. And before everybody joined us, I was sharing with Dr. Smith, my kiddo got vaccinated a week ago. So we were like, woo woo, we can go out to a restaurant. So we're very, very excited. And I wanted to share that with you guys, because I know a lot of you guys like me had a lot of questions, had a lot of concerns. And today we're going to talk about that. So Sarai, next slide. So today we do have our fabulous Dr. Fox with us that is going to give us some information about CPS. And then we also have Dr. Smith, who's joining us from Lurie Children's Hospital, who's going to give us a lot of information and answer a lot of the questions that you guys provided during the RSVP. There was tons of really good questions. So remember, we are recording the session. We'll put it up on YouTube. Once we put it and send you guys a link, please share it with everyone, because we need everyone to have this information. And again, we're going to go through some of the questions that you guys submitted, and then we'll open the Q&A. Okay, thank you, Sarai. Next slide. And don't forget, our next session, we are going to have the team, Dr. Chavarria's team, that's going to talk about summer programming for our kiddos and how we can support them during the summer with some learning. So the information, we'll send it to you guys via email, so you guys can also click on that link and RSVP for our next session. And again, today we're going to talk about the COVID-19 vaccine in kids. It's something that's in everybody's mind. So we brought the best of our experts to share the information with us and really get us through that process. Next slide, Sarai. So like I mentioned, we have Dr. Fox from CPS and Dr. Smith. Dr. Fox, you don't need an intro. Everybody knows you and loves you, but I am going to let you talk a little bit about yourself for those folks that are just joining us. And Dr. Smith, like I said, is coming from Lurie Children's Hospital and her background in pediatrics, dealing with obviously the little people. So we're going to make sure she's going to introduce herself as well. So Dr. Fox and then Dr. Smith.
Oh, hey, everybody. Dr. Ken Fox here. I am the Chief Health Officer of Chicago Public Schools. I lead the Office of Student Health and Wellness. And you've probably gotten a million emails and letters, et cetera, from me over this past year, 15 months. But I have been a pediatrician myself now over 30 years. Can hardly believe that. But I am delighted to be here and to be joined by my eminent colleague here, Dr. Smith.
Thank you. Thank you guys for having me. I'm so excited to be here. Good afternoon, everybody. I'm Dr. Shawn Smith. I am also a pediatrician. I am at Lurie Children's Hospital and Northwestern Hospital. I work primarily in our neonatal ICU, so I take care of the very little ones. I am also the Director of Health Equity Learning and Development, which is a newer role where I have been tasked to have discussions about implicit bias for not only physicians and nurses, but our trainees, so that we are able to better take care of our patients. And I'm so excited to be here with you all to talk about the COVID vaccine and our children.
Fantastic. Thank you both for introduction. I can never do justice to introducing you guys. So it's better for you guys to totally do it. So thank you so much for both giving us your time and your expertise tonight. So I think, Dr. Fox, we're going to get started with you.
Sure thing. Thank you, Berenice. And I'm going to be super brief because I want to turn this over to our featured guest today. Let's go to the first slide I have. I figure, this vaccine thing, a huge breakthrough for humanity. And it's for all of us. It's for all of us to use to protect ourselves. And there's some great information that's made available by the Chicago Department of Public Health. This is just one of the flyers, many flyers they have. But the points here, I think, that are important for everybody to know. These are safe and effective vaccines. They're free to everyone. This is regardless of your insurance or immigration status. And there's ample supply of the vaccine now. It's widely available in the city. That wasn't the case 2 months ago, but it is true right now. Let's go to the next one. The next slide. Yeah, this is just more info. The links here, really, I put this in here because of the links. You can click on these and you get the most reliable, I'd say, and up-to-date information. This flyer does contain information that you can use about, how to get the vaccine once you've decided to do that. But it's mostly in here for the link, so you'll have that for your use. Let's keep on going. All right, so I like to think about the vaccine in the context of all the other layers of protection that are in place to keep us safe as can be from COVID-19. So we're talking about cloth face coverings and social distancing, clean hands, and keeping the spaces clean. And in the case of schools and other institutions, contact tracing. And this is designed to isolate the cases right away and to identify the direct contacts of the case of the known case and to put them in quarantine. So we have these different layers of protection. The vaccine is just another layer of protection. Let's keep on going. The next slide, please. Great. So here's a big question. Are COVID-19 vaccines safe for kids? This is a big topic and obviously a huge focus for people like me and Dr. Smith, both of us pediatricians. But right now, the answer to the question is yes. And we know this because of that's what the evidence, the scientific evidence tells us. There were randomized, double-blinded controlled trials. And that's the kind of evidence that we rely on to make a recommendation like this. Right now, the Pfizer vaccine is the one that involved the trials for the younger set for children 12 and older. This trial involved over 2,000 children. There was 100% efficacy, which is very unusual for a study like this, but that's what was found. And there were no adverse events found. And those are the reasons why this has been authorized by the FDA and approved by the Centers for Disease Control and Prevention. Next one, please. Thank you. So which vaccines are approved for kids? The answer is it's the Pfizer vaccine. Okay, so this is for kids as young as age 12 years and older. The other vaccines, Moderna and the Janssen vaccine produced by Johnson & Johnson are for people 18 or older. Let's go to the next one. Right. Why should my child get a COVID vaccine? Well, there are a number of important answers to this question. And the first is that kids can get and can transmit COVID-19. I mean, the evidence speaks for itself. 3.8 million cases among US children and counting, over 300 US child deaths. So yeah, this is something that kids can get and transmit. But fortunately, now that there's a vaccine, the situation is very different. There's a safe and effective vaccine. It prevents cases from occurring. If they do occur, it would lessen the severity of the cases and it prevents death. Another way to put all of this is to say that the vaccine allows for a safer return of kids to their friends and their family and their activities. Let's get the next one, please. I think this may be the last. Yeah, so I threw this in here because it provides some information in addition to what was linked in slide number 2. Here's another link just you can go to and you can get information about how to get the vaccine or where you can get the vaccine. And this is a pretty handy tool right here. You enter those things that I've listed on this slide. Another option is to call. You can do, if you're not really into going online, you can call the Chicago Department of Public Health at the number that's listed here. And with that, I'm going to turn it over to my colleague, Dr. Smith.
Thank you, Dr. Fox. And I can't remember, I don't think I said in my introduction that I am a CPS parent. I have a 2nd grader and a 4th grader. They are both too young to receive the vaccine right now. But I have them hopefully signed up for one of the trials, or at least can't wait until the under 12-year-old children can get them. So again, Shawn Smith from Lurie Children's. I'm so happy to be here today. So this is just a little bit about how vaccines work. I know that you all have heard a lot about COVID. We all have over the past year and almost a half. But the vaccines introduce a weak or an active form of disease in the body. So it is not live COVID. It will not cause you to get COVID, but it is what kind of looks like COVID so that your body knows how to respond to COVID. And then in the middle, your body reacts by stimulating the immune system to create antibodies or protection around this, so that if you are exposed to COVID, your body knows exactly what to do. And then the third part is the antibodies remember the disease and can defend against it if a person becomes exposed to it. There have also been a lot of questions about the vaccine creation process. One being, how have we gotten this vaccine so quickly, and is it safe? And so what this slide is just showing is that all of the I's were dotted, all of the T's were crossed in the regular vaccine creation process that has in the past taken multiple years. We were just able to combine them and kind of overlap them. So if you look at the top one where it shows you the traditional, there's still, you have an issue, an infectious disease that you're looking at. You're developing what partners are going to be involved. You have preclinical trials of patients. You have a small scale trial, and then you'll have phase 1, 2, and 3. And then you're partnering with manufacturers to scale and make the vaccine on a commercial level and validate it. And then also making it on a larger scale and making it available, and also licensing it. And if you look below, you see the same thing. It's just a shortened process. So it is amazing what can happen when we are in a pandemic, which most of us have not really seen, definitely not to the scale of COVID-19, of what can happen when we are able to put all the money and all the resources and all of the institutions, CDC, NIH, to this one thing that we're targeting that was affecting so many of us. I wish we could treat all illnesses in this manner, but this is how we're able to get this vaccine so quickly. This slide just goes over briefly the 3 vaccines that are available currently in the United States. The first one is the Pfizer or the BioNTech, which is the only one that's currently available for ages 12 and up. It is an mRNA vaccine. You receive 2 shots, 21 days apart. The next one is the Moderna vaccine, which is also an mRNA vaccine. Same, you receive 2 shots, but about 1 month apart, or 28 days. And then the third one, which is the more recent one that has become available, is the J&J or the Janssen, which is a viral vector vaccine, which is actually similar to some of the other vaccines that we have seen in the past. And that is a one-shot vaccine. And then just at the bottom, all 3 vaccines are given as a shot in the muscle of the upper arm. You get to choose. I always choose my left arm because that is my non-dominant arm. And neither of these vaccines contain eggs or preservatives or latex. And there is more information of exactly the ingredients in the vaccines. And then I know Dr. Fox said this, but I'm going to say this again so we can all be on the same page. The COVID-19 vaccines are very effective and they are safe. All 3 vaccines have been shown to prevent death, and all 3 vaccines have been shown to reduce the number of hospitalizations for severe cases of COVID-19. That's my colleague right there, Dr. Corin. She's a pediatric GI doctor at Lurie Children's. So I know the question too is, what are the side effects of the vaccine? And just to put on top, any severe allergic reaction, or what we usually call anaphylaxis, is very uncommon. It is 1 out of every 100,000 doses. But the common side effects, which people have reported, not everyone, but local side effects at the site of injection, so a sore arm, you can have pain, redness, or some swelling. Or you can also have systemic, or what we call whole body side effects. Some people have reported fever, fatigue, or just being tired. headaches, chills, muscle pains or aches, joint pains or aches, and then rarely some nausea or vomiting. There's been a lot of myths circulating out there, and I know those give people pause, but I just want to highlight some of the ones that I've heard and heard more frequently. Again, the vaccine does not give you COVID. So even if you were to have some side effects from the vaccine, that is not COVID. That is your body's immune system responding and stimulating the antibody response so that if you are exposed to COVID in the future, your body knows how to fight it immediately. The vaccine does not link to your DNA. So the mRNA, the vaccines enter your cell, but they do not enter the nucleus where your DNA is. That is protected. There is no infiltration of your DNA. There is no tracking device on the vaccine. And natural infection, so if someone were to get COVID-19, that has not been shown to cause infertility. And there's been no association with infertility from the vaccine. And there's also been quite a few women that have become pregnant since and during the pandemic. Many have had the vaccine, and those women have been followed as well. And there has been no adverse outcomes at all from being vaccinated. So a little bit about COVID-19, kids and teens. Again, the Pfizer vaccine is available for children 12 years and older. All vaccines authorized for children have been shown to be highly effective and very safe for children in large clinical trials. And children have definitely suffered medically, social, and emotionally during the pandemic. I know my little kids have barely been anywhere. And it is definitely important for them, especially when they're eligible, to receive the vaccine when it becomes available. So that we can all get back to our lives and our friends and school and all the things that just make us whole. And then, so just to know that COVID-19 is still a threat. It is still out there. People are still becoming positive and testing positive every day. People are still getting admitted to the hospital. And unfortunately, there are still deaths. There was a recent report that showed that 22% of all new COVID cases were in children. Now, thankfully, it is true that children do not get as sick as adults, but there have been serious complications and there have been some deaths, over 300. Vaccination is the best way we have to prevent kids from being sick and also spreading it to people that we love, whether it's grandparents, parents, family members that are immunocompromised, and also the little ones, our kids that are 11 and under that cannot be vaccinated yet. And we cannot get back to normal life without kids being vaccinated. So just to see the numbers, I mean, ideally, we need 70% of the population to be vaccinated to reach herd immunity, and kids make up 21% of the US population. And then my takeaways from the slides is COVID-19 has caused significant illness and death. If, like me, you guys have known someone that has died from COVID or have gotten sick or been hospitalized with COVID. Black and brown communities are impacted more by COVID-19 for a variety of reasons, and there is higher rates of illness and death. All three COVID-19s are highly effective. The vaccine is the fastest way to eradicate COVID-19 and this pandemic, and the vaccines are our best tool for returning to normal. And the success of the vaccination program depends on entire families, including our children. And Lurie Children's is a site to be vaccinated. Here is the link below. So we would love to have you sign up and make an appointment and come get vaccinated.
Awesome. Thank you so much, Dr. Smith, Dr. Fox. And thank you for putting some of those things. I did hear about the DNA one, so thank you for putting that up. Some parents were asking me, and I was like, I don't think so, but let's ask the experts. So, so thank you for putting that up for us. So we're going to get started. Parents, as you heard some information, soak it in. I know you have more questions. Use the Q&A function and type in your questions in the Q&A function in Zoom. So if you have additional questions, you can write them in Spanish too. So I'll read them and interpret them. So don't worry if you don't speak English, I can do that for you. But we're going to get started with the questions that were submitted. So one of the questions, the first question that we have is from Misty from Hugger. And it says, I don't feel confident about the vaccine. What is there to know to gain trust and confidence in the vaccine? She's very concerned about herself and her daughter. So what can we tell this parent so that she has more confidence in the vaccine?
I think that's a great question. I think the answer for me is get the best information you can. You go to the reliable sources and you know, maybe it's your pediatrician or nurse practitioner, you know, and you get your questions answered. Maybe you need to sit down and take time and really talk it over more one-to-one. Sometimes people learn better that way. Do that. If that's you, do that. The key thing is to get your questions answered. But the bottom line is, you know, there's a time to be worried. There's a time to be bold, and be bold to take the steps that you need to keep yourself and your family as safe as possible.
Thank you, Dr. Fox. Dr. Smith?
I would agree with Dr. Fox. You know, what's so important, one, Misty, thank you for the question, and that you're here today and you're asking and you're being honest and vulnerable, saying, I'm interested, but I'm very scared, I'm fearful. And this is new. But I agree, it is important to get your questions answered and that you have the right information so that you make the best choice for your family. What I would hate is for people to not want to get the vaccine because they have misinformation. So do be careful which sources that you're going to. I go to the CDC for everything because there's a lot of op-eds and journal articles and things that even come from the news. I go to CDC to fact check and make sure that that is true. You'll see a lot of things on Facebook. You'll see people even that, you know, family members will send things and it's not necessarily true. So just make sure that you have factual information. Talk it over with your daughter as well, because children ages 12 and up and even younger. My kid just told me the other day that, you know, it was unfair that I got a chance to go out to dinner. I had a friend had not gone out. We were all vaccinated. And he said, it's not fair that you get to go out. And I said, you're right. It's not fair.
Yeah, for sure. No, definitely. So like you both said, getting educating ourselves. I know I did that as a parent. We had a lot of questions and we looked it up. My husband and I discussed it. We discussed it with our munchkin who turned 12 and he had a lot of questions too. And we looked it up together. So it was a learning experience for all of us. And I think at the end we were like, okay, we're confident and let's do it. And he was scared to get the shot just because it's a shot. And then when he did it, he was like, it was so easy and simple. And I was like, all right, will you get another one? He was like, I could do it, Mama. So I was like, all right, let's do it. So thank you both for that.
I hope he has a selfie too with his Band-Aid.
We do.
Gotta get that pic. Yep.
Oh yeah.
Did it really happen if you don't have a selfie? Or
exactly. Exactly. Thank you both for that. The next question that we have is from Lucy from a CPS school. And her question is it recommended for children with autism? So is the vaccine recommended for students who have autism?
Yes, totally fine. Totally fine. Kids with all kinds of chronic conditions can get this vaccine safely. That's a really important question, but yes.
Absolutely agree. And I would also add in too, that I know that I heard from parents during the pandemic and before school reopened, that children with autism, the parents were very, all of our children had difficulty being on screen all day. But children with autism and who had special, whether it's speech or occupational therapy or physical therapy, often had those services either at school or in person. And to not have those was a huge deficit. And so absolutely children with autism should get the vaccine, but even more so that they can get back to school and get back to doing all the things that they were doing before COVID.
Thank you both for that. Definitely for kids who have a harder time, being in the, I mean, we're adults and I'm like, I'm zoomed out to my meetings. So I can totally see the kids. Thank you for that. The next question that we have is from Leonor from Green Elementary. And her question is, I understand the vaccine for children is ready and available. However, again, I think with the safety, how safe is a vaccine for children who have medical conditions? And in this case, is asthma.
Right. I think, again, here, the answer is that this is safe and really important, especially for somebody with asthma. Kids with chronic conditions like asthma bear higher COVID risks than kids without those conditions. So I think not only is it safe, but this child would have a special need in a way to get the vaccine, to get the protection that the vaccine offers.
Agree, Dr. Fox. Children with asthma were considered tier 2, so a higher risk. So having a respiratory illness or concerns for a respiratory illness makes you at higher risk for being sick with COVID. So those children should absolutely consider getting the vaccine.
Yeah, thank you guys for that. And I know a lot of parents had those questions, right, with asthma. So thank you for clarifying that for our parents. Our next question is from Maria from Patrick Henry. And her question is, will vaccines for students be available at schools? And what age groups would those be? So Dr. Fox, that might be for you.
I would say yes. To some extent, this is already happening. There's, for example, a series of Saturday events that are hosted at Chicago Public School locations. And this just started basically 2 weeks ago. And they'll continue for altogether, there's 6 consecutive Saturdays between now and the end of June, where this is possible. And you can go to the CPS website to get the info, the specific details about exactly where, but they will run. So that's one example. Also, there will be a vaccine available at many of the school-based health clinics, and certainly at a lot of the health systems that those clinics belong to. Like, for example, CPS has a number of school-based health clinics that are run by Erie Health Center. Well, Erie also has a teen clinic, for example, and I know that the Pfizer vaccine is available at Erie's teen clinic. But as for the schools, so there are these special events. There are opportunities that will happen at school-based health clinics, and there may be more, so this is already happening to some extent, but I think it's likely that that this will be true more and more for school settings.
Yeah, no.
But the key thing really is, you can get from your primary doctor. That's the best place, from federally qualified community health centers. That's another option. And then there are a number of city sites as well. And like we were saying before, you can go to the links and find all the places where you can get a vaccine. But as for schools, will be part of the solution here.
Yeah, no, for sure. So everybody visit cps.edu to get some more info, and then definitely call your kid's doctor and see if they're available at the clinics, and you can take them, and then you can do a lot of kids miss their health exam. So get that done, and also the vaccine, and then we're ready to go. I plug that in, Dr. Fox, just for you.
Appreciate that, because these are not the only vaccines that kids are maybe due for, and you have to really check in and make sure, you don't want to get some totally preventable thing, that'd be crazy. Who wants to get, pertussis or measles or whatever. There are a whole bunch of vaccines that are tried and true and that are really already part of the normal schedule. So you want to make sure that you're totally up to date on all of those things. So I do appreciate that.
Thank you. Yeah, no, for sure. My kiddo went into 6th grade, so I know he needed shots, and we got all of that. So parents, please do that. That's super needed for the schools.
I'll just say one thing, Bernice. The COVID vaccine can be given with the other childhood vaccinations as well. So if you are behind or just because of COVID, hopefully please get back into your pediatrician's office and get caught up on everything. That's for the adults too.
But no, thank you for that, because for sure that was going to be the next question for parents. Like, can they all get them together? So you just beat us to that. So thank you for that.
Those Saturday events, yes, the whole family could do the whole family can be involved there. So yeah.
Yeah, absolutely. Thank you for that, guys. The next question that we have is from a parent, Leticia, And her question is just what general allergies. So is the vaccine safe for them? Her kid is allergic to fish. So would this vaccine have some sort of impact if they have allergies?
Yes, so this vaccine is safe for food allergy. If you have an allergy to fish or cats or dogs, yes, you can still get this vaccine. The only and for autism and asthma, the only contraindication is if you have had an anaphylaxis or a severe allergic reaction to the COVID vaccine or a similar vaccine in the past, and that is very rare.
Thank you for that. I appreciate it. And I know my kid has allergies, and he did okay, so we're good. The other question that we have is from Myra, and I've heard this from a lot of parents that we've spoken to. She has a 13 and a 15-year-old, and the kids themselves are refusing to get vaccinated. They're scared that this might have some future, bad things happening to them. So what are, you mentioned some of the side effects. If you guys can mention some of the side effects as they get the vaccination, is there anything that they should be worrying about for the future? What can we tell these parents to share with their kids?
I can just kick it off here, but I'll turn it over in just a sec. I would say, I mean, everybody obviously has to be concerned about COVID itself. Like, you look around, you see the devastation that it has caused. So this is a way to prevent that stuff from happening. I think it's really great to really talk to the kids. You talk to them, you make sure you're straight shooter on the information, and you let them know that yes, there can be side effects, minor ones and temporary ones, right? Like what Dr. Smith was saying, you could have fever, you could have aches, you could have chills. There's a long list of things that could happen, but these are minor and they're temporary. I mean, they only last a day or two at the most. And this is far less of a worry than the worry about getting COVID itself. So it's just about helping kids get the right insights about risks and benefits and how you balance those things. These are never easy decisions, but our parents are in charge, and they have to help bring the kids along to come to the right decision, the thing that's going to make the child and the rest of the family and the community most safe.
For sure. Thank you, Dr. Fox. Dr. Smith?
Yeah, and I'll say, so for 13 and 15-year-old, they're hearing everything that we are. They are exposed to social media. They are watching the news. They're hearing from their friends. So they're hearing a lot of the myths and things that have been scary and often untrue as well. So I agree. Make sure that you all sit down and are educated about exactly why it's so important to get the vaccine. Now, the other thing I'll say, no one really wants to get a poke or a shot, but you can find something that's, going to be special for after it is. So if you're coming down to Lurie Children's or going somewhere by your school, maybe you guys can go get ice cream after, or go to the bookstore and grab a book or something that you just haven't gotten a chance to do, and that's something they can look forward to. But if they are concerned about long-term effects, so even though this whole year and a half has been quite a blur, we now have data for those participants who were in the initial trials now for over a year. So that started in the spring of 2020. So we now have data for a year, and we now have data for already more than a few months for the teens, and the younger children will be getting started. And then there's also quite a few, the VAERS and the V-Safe are two electronic, so you can answer questions on your phone, which everybody is hopefully opting into. So once you get your vaccinations, you are being asked questions. How do you feel? Do you have a fever? Do you have any side effects? Do you have a sore arm? So that now we have data from all the millions of people who have been vaccinated. So we have that data, and we're tracking that data. And also, as you can see, when there was an issue that came up with the Janssen vaccine, it was immediately like now they're asking questions when you go into, for women, they're going in to get a mammogram. We noticed too that there were, for example, increased lymph nodes. And so now the question is, have you gotten a vaccine? Which arm did you get it in, and how long ago was it? And then if there's any things that any medical conditions or anything that's arising, they are, putting that in the database, so that when those they were able to put a pause on that and look into that. Very confident in that. And so it's also very important for all of us to answer those questions as well. So you are also part of giving those answers.
I could just add one thing too to those excellent comments, that the trials really gave us the answers, right? Are they safe? Do they work? Okay, but it's really important that everybody knows that the vaccines, that it doesn't end there, that the vaccines are really closely monitored. You know, even after the trial's over, you're still monitoring, you're looking at, well, what does this mean across a population, a huge population? And so the vaccines are, there's ongoing study, there's ongoing monitoring. That's how we knew about the issue that Dr. Smith mentioned. We know about it right away, you can study it intensely and figure out, do we need to take a pause, or can we go forward safely?
Yeah, no, for sure. And thank you for that. Like you said, this is the CDC, right? All those reports are out. You can guys see the numbers. And as your pediatricians, I think that's important to have communication with them. So thank you both for that. The next question that we have is from parent Janet from Back of the Yards. And you answered this a little bit, but maybe we need a little bit of a refresher. Is what exactly does the vaccine do to your body? Like, how does it work? If you guys can walk us through that a little bit more so that parents can refresh it in their mind.
So the mRNA vaccine, which again is a newer vaccine for us, but what it does is it is wrapped in like lipid, which is just means fat, and this kind of small nanoparticle, which just means really tiny. And what it does is it introduces to your body what the spike protein looks like. And the spike protein is just a small part of the COVID vaccine. That is the part that is very antigenic, means that's the part that causes our body to react to it. So the mRNA part kind of looks like that spike protein. Again, it's not the actual COVID vaccine, but it looks like the spike protein, and it enters your cells, again, not your DNA, not your nucleus, and it teaches your body how to react to that protein and to make antibodies to it. And then also that mRNA that was initially introduced into the cell, that is broken down and degraded pretty quickly, so it does not stay there, but it causes your body to make that immune response. So that is both how the Pfizer and the Moderna mRNA vaccines work. And then the other vaccine, the J&J, the Janssen vaccine, is what's called a viral vector vaccine. And those vaccines are actually similar to the vaccines that we've been more used to. So it takes a different virus, like a copy of it. So again, it's not real COVID, but it uses like a human viral vector to, again, introduce what looks like that spike protein into your body, into your cell, so that your body makes an immune system response for it. So it's almost like seeing a pretend COVID beforehand, so your body knows how to protect itself, so that if you actually come in contact with COVID, your body is able to defend itself immediately.
Dr. Fox, did you want to add something?
Oh, no, I think she really covered it. You know, I mean, another way you could think about this is sort of like the vaccine is like a recipe or a set of instructions. You introduce the recipe or the set of instructions to a cell, and the cell makes a protein that then teaches your body how to protect itself against the actual threat, the real threat, which is the virus.
Got it. No, thank you both for that. I think it's really important parents know when they get vaccinated in the kids, right? We're not putting the germ right into them. This is just a protein to help your body make those antibodies to fight it in case you come in contact with it.
Right. The only other thing to say is that, you know, once that recipe or set of instructions has done its job, it disappears, right? It's gone. So it's not, you know, it's not incorporated permanently into your body or your genes or anything like that.
Got it. No, thank you for that, for both of you for that. Thank you. The next question that we have, it's from a parent from Christopher Elementary, and her question is, her child has muscular dystrophy. Can her child get the vaccine?
Yeah,
Yes.
again, yep.
I like the both of you at the same
Yeah.
time. Like, yes.
Perfect timing. That's a
Yeah.
great question. That's a great question. Because yeah, I mean, you do hear this talk about, you know, the vaccine being injected, it say into a muscle. You know, if you have an issue with your muscles, and in a way, that's a good question. Will it still work? Apparently, it does,
Yeah.
which is awesome.
Absolutely. Awesome. Thank you guys for that. And I think I'm going to go into the Q&A because parents have been typing away. So I want to get into those and not let those by. So let me read a couple of them. One of them, and I think you guys can answer, you guys already answered it, but maybe you can refresh it. The question's in Spanish, so I'll interpret it or translate it. It said, when is the vaccine for 12-year-olds available? And is there a weight limit? So her kid is really, really skinny. So she's concerned if there's a weight limit for her child to get the vaccine.
Right. So that vaccine, Pfizer vaccine, is available right now for kids 12 and older. And yeah, the weight, it doesn't matter at all. No. And you get the same dose no matter what your weight is. And it works equally well.
Perfect. Perfect. The other question that we have is from Esmeralda, one of our parents. And it says, when will the vaccine be available for children 11 and under? And yeah, so when would it be available for them? Because I know, like you said, Dr. Smith, you have smaller kiddos. So I know that everybody's anxious to get that. So when will we have it?
So the date that I heard that is out there right now is September. And that would be specifically for 2 to 11 is the hope that it'll be available in September. And then for under 2, so 6 months to 2 years old, that one will be more like in the winter. So at the end of the year. Now, of course, those could change, but that is the hope right now. So they are enrolling right now and starting the trials now for the kids under 12. And we will follow those results. They are planning to de-escalate for those children, meaning it won't be the same dose that the 12 and 12-year-old to adults have gotten. So it will be a smaller concentration. And so that's why that will take a little bit longer, but we are hoping for September.
That's $1 million question right there. It can't happen fast enough as far as I'm concerned. I got a grandchild I'm just like, please, you know, but by the time that he's old enough to get it, yeah, I'm hoping that'll be available. Yeah.
No, for sure. Yeah. So stay tuned, folks, and just keep coming back to the sessions. We'll have information. So stay tuned. So thank you both for that. The other question that we have is from Veronica, and she says, once somebody gets the vaccine, can they still get COVID and be contagious and give it to other people?
So I will say that the likelihood is very low, but it is still positive. It's not 100%. Now, the vaccine trials for the 12 to 15-year-olds that Pfizer did was 100%, but just in general, the numbers for the adults, it was 94 and 95% effective. So there is a chance that you could still be, contract COVID. The idea that you would get sick from it or be needed to be hospitalized or death is extremely low. And even the idea that you can pass it on is low, but it's not zero.
Got it. No, thank you for that, Dr. Smith. We do have a question from another parent that is asking if you guys know, if you can shed some light into this, why is the minimum age for the children to receive, it's 12? Why wasn't it 10 or 11? They have a son who's 11, who just turned 11 last month. So obviously, like you, Dr. Smith, we won that vaccination. So mom and dad are both already vaccinated, and one of them is high risk. So what was there a reasoning behind that 12?
I do not know the answer to that one. That's a good one. That's a good one.
Yeah, that is a great question of why 12. But I do know that for the younger kids, so I believe the Pfizer has 30 micrograms in the vaccine, and Moderna has like 100 micrograms. But again, they're not the same, so I don't know that you can compare those apples to apples. And I know for the younger kids, they are going to decrease that dose. So I don't know if that's going to be 20 micrograms or 15 micrograms, and that may be part of the trial, because we do want to make sure that the children still get antibodies, but that they also don't have more side effects than what the tweens or teens, had as well. So that's what they're going to be looking at. But I don't know if I know the answer. Maybe 12, but 13. I know I have a new 10-year-old, so I also missed the cutoff as well. And so yeah, that's a great question.
Awesome.
Well, I'm gonna search that one out.
Yeah.
I'm finding answer. I'm gonna send it to Bernice.
Yeah, sure. No, and we'll send it out if you
That's a
guys
great
have more
question.
info.
I do
Definitely
not
send it out.
know.
Yeah. And we have another question here from, oh my goodness, I lost it. Let's see. Okay, from Heather. And her question is about that vaccine and the stand on CPS. So with students starting to get vaccinated, what is CPS stand on masking? That's one. The other one is, and require vaccinations to attend school like any other vaccination. So would the COVID vaccine be mandated to start? And or are they, or let's see, or would there be just posted final FDA approval? So what's the stance on continuing to wear masks?
Okay.
Be mandatory.
All right. Mask, yes, always universal. That's not changing, right? People may have read stuff in the news about changes in mask rules and relaxation. That doesn't count for schools at all. A school is a congregate setting. So, the relaxed masking rules do not apply to congregate settings, nursing homes, shelters, prisons, and schools. So, so there's that. The other question was about the mandate. No, the vaccine will not be mandated. We can't even really do that. You can't mandate a vaccine that's under emergency use authorization, first of all. But more importantly, it's really the state, the Illinois Department of Public Health, that decides which vaccines are mandatory in the state of Illinois and which ones are not. And we follow those rules. Right now, there's no mandate for this vaccine for anyone. It's a great idea, super important, good to do when you're eligible, but it's not mandated.
Yeah, no, and thank you for that. I think a lot of parents, now that we're getting our kids vaccinated, that's the question, right? Like with teachers, with the kids, are we going to wear masks next year once we reopen? So those are great things. And clarifying, thank you, Dr. Fox, that, it's not CPS, it's the state who sets up those guidelines for vaccines, and we just, follow the rules. So thank you for clarifying that. Go ahead.
Oh, I was just going to say, and I will say there definitely have been colleges who have put out their statements that they are requiring all students and faculty to be vaccinated prior to school starting back in person in the fall. Because again, our college students as well have been affected by this. So that is obviously a little bit different than CPS, but I have seen quite a few college statements on that.
Yeah, no, for sure. Yeah, I have a couple of friends who have kids in college, and yep, they had to get it. So, and we'll probably see a little bit more of that as this evolves, right? We do have another question from a parent, and I think you guys answered this already, but if you can just again answer it, just to get again our brain flowing with all this information. Our parents keep having the same questions, and in a different way we can answer it so that we get that info. So we talked about the doses. So are the doses the same for kids that they are for adults, or are they getting the both shots? Is it a different dose? How does that work?
Same dose for the, whether you're 12, 18, or 24 or 65, same dose. But that may not be true, as Dr. Smith mentioned earlier, for the younger, kids younger than 12. We'll see.
Correct.
Got it. So parents, if you have 12-year-olds like I do, like it would be the same that you got. Hopefully you got it too. And then once we start getting to the really, really young kids, then we probably will see a change. But if you have munchkins that are 12, you'll get the same one, or they will get the same thing that you guys have had. Fantastic. We do have another question. Let me, It says, where has this mRNA technology been utilized prior to this to give patients confidence that this is reliable? And this is coming from Patricia.
Yep. So I can take a stab at that one. So the mRNA vaccines is newer, but not completely new, and definitely not new in the lab. So if you guys have been following Dr. Kizia Corbett from NIH and one of the developers of the Moderna vaccine, and a young Black woman, PhD, she specifically has been working with mRNA vaccines for years. I think she's been at NIH for 6 years. And I will say this, if, again, I work in the neonatal ICU. So a couple of years ago, if you guys remember, Zika virus was a big deal and causing a lot of alarm and caused for alarm for women of childbearing age. And so, people weren't traveling to certain places. We were trying to figure out, what causes this. And Zika kind of went away. But I know specifically Moderna and Pfizer, one of the reasons why those two companies were able to have this vaccine readily available so quickly was because they had actually already prepared. They had all the ingredients, kind of the lipid and the, outer nanoparticles ready to make a vaccine for Zika virus. And then Zika went away. So they had a available, and they had already been using and studying the mRNA vaccine for years in the labs and on animals and on other things. We just hadn't had them in vaccines, but it had been ready to go for that, and they have been excited about using it because it showed so much promise.
Awesome. No, thank you for that. I think the next question that we have is kind of on that same note, and it's directed to you, Dr. Smith. They put there, okay. Dr. Smith. So it says, my understanding is that COVID-19 is a branch of the coronavirus family, and that the medical and scientific community have been studying and researching this virus in order to understand it, so that historically knowledge and research was significant to help develop the COVID-19. So is that correct?
Absolutely. So we have to specifically call this one COVID-19, because if you just say coronavirus, that is a common virus. Like when we think about the common colds and our kids in daycare and school and the colds that we all get every year, once a year in the winter, it is most likely a coronavirus, which is a common cold. You don't even have to get tested for it. You don't need to go to the hospital for it. You just deal with the symptoms. Maybe you take something, you're not feeling as great for maybe a week or two, and it goes away. So there are multiple different coronaviruses, but we had needed to really test for all of them because it did not cause severe illness. But they have been around for years. But we had to specifically call this one the COVID SARS-2 or coronavirus 19 to specify that this one is causing the pandemic and is having serious illness. But absolutely, coronavirus has been around for many, many years.
Exactly. Sometimes people will refer to this COVID-19 virus as a novel coronavirus. Yes. And by novel, they mean new. There's something different genetically about this member of the coronavirus family compared to others in the family.
For sure, yeah. And for you guys that are scientists and doctors, my hat's off to you, because I'll be like, what are you talking about? So thank you so much for explaining that to us and for letting us know how that works. The last thing I want to read is a comment from one of our parents, Jasenia, and she just says she's very excited and hopeful of how the mRNA technique works and for the future of treatments for other stuff. So this is the beginning of something really good for humanity. And she has a 6 and a 9-year-old at Orozco, and she can't wait to have the privilege to get them vaccinated. So thank you, Jasenia, and share that with everybody that you know. So I really appreciate that comment. And as we're getting close to the end of our time with you guys, Dr. Fox and Dr. Smith, if you guys can give us like the main, from what you guys spoke, from what we share with our parents, the biggest takeaway that you think you want to share with parents. So if they forget everything we said today, what's the biggest takeaway that you want them to leave with today? So Dr. Smith, we'll go with you.
One thing about that last comment from Yesenia too, I hope that we get more budding scientists and researchers from this, that our children are seeing this and it's happening live, and they are excited to help find cures for diseases that we still don't have cures for. So I hope that happens, one. And then number two is, you know, in order for us to see each other and to get back to normal, we do have to get vaccinated. So ask all your questions, talk to your friends, talk to your family, talk to your physician, but please do consider getting vaccinated and your children.
Thank you, Dr. Smith. Dr. Fox?
I guess I would say, you know, this COVID vaccine is a great scientific breakthrough. You know, it's a great advance for humanity, you know, people all over the globe. It's safe, it's effective, and for once, the best of what science has to offer, the greatest breakthroughs, they're available to everybody here. You know, it's not like, oh, we're gonna keep this just for ourselves, the, you know, privileged people. No, it's everybody. It's free, it's accessible, you know, it's regardless of your insurance status and your immigration status in Chicago, you know. And so we have to take advantage of it. We have to make sure that we get, you know, access to things in an equitable way. And here's an opportunity to get access to something that really matters a lot.
For sure. Thank you, Dr. Fox, for that. So yeah, guys, if you're able and willing, please get vaccinated as we're gonna, you know, think of the summer. You're able to see your family if everybody's vaccinated. I know last year we missed Christmas and Mother's Day and Thanksgiving, you know, now my family's vaccinated. I'm all excited for a barbecue. So, you know, just to think of those things that we can have again. When you're thinking of that, and like Dr. Fox and Dr. Smith said, get informed, look for those sources, ask your doctor, and make the best decision for you and your family. And hopefully it'll be to get vaccinated. So everybody, thank you so much for coming and joining us. Again, we'll send the DAX and we'll send all the links to you guys via email tomorrow. And then we'll post the video by Monday. And then please share it with everybody, share it with your community, share it with the rest of the parents at your school. Thank you everybody for coming. Dr. Fox, Dr. Smith, thank you so much for giving us your time and your expertise as always. You guys were amazing. So thank you so much, everybody, and have a good night.
Thank you.